Hello. Hi, doctor.
Hello, how are you?
I'm good. My name is Deepti, and today we have Dr. Abhishek Bhattacharjee with us. He is an oral maxillofacial craniofacial surgeon in Raj Hospital, Ranchi. So today we are going to discuss about the topic cyst and tumors of maxillofacial region. So, doctor, can you please introduce yourself?
Uh, Good evening, everyone. I am Dr. Abhishek Bhattacharjee, oral and maxillofacial surgeon practicing in Raj Hospital, Ranchi. So today our topic is cyst and tumors of maxillofacial region, which is a very vast topic that we have chosen for. So we will be dividing into numerous sub branches for this topic. So to begin with, I'll just give a brief review over this on this topic. So to start with, I'll start with the cyst first, and then I'll go to the tumors of the maxillofacial region. To begin with the cyst, what is actually a cyst is? A cyst is a pathologic cavity or a sac-like space that is lined by either lined by epithelium, and it may contain a serosanguinous fluid, gaseous, or any type of liquid or semi-liquid material. So the cysts are of various types that is found in the maxillofacial region. If we start in the facial region as such, so we have seen dermoid cyst is the most common cyst of the face, which are seen in the skull or wherever the bone has been is fused in the facial skeleton. We can find that due to impingement of the epithelial cells, the tissues are formed and it forms later. It forms as a cyst. So the most common cyst that we see in the facial region. Then other cysts are sebaceous cyst is formed to the sebaceous glands entrapment that occurs. Those are also very common. And when we see in the jaws as such, the cysts are of two types. It can be of developmental origin or of retention origin. So retention cysts are like mucocele in the mouth. We can see in the lips that mostly see a bump-like elevation, bluish discoloration is seen. So those are very common in day-to-day practice. Sometimes the person bites the lip and they come to complain that sir, there is a swelling in my lip and it is not subsiding. And we have seen months after months it is not subsiding and it just keeps on increasing. Whenever they bite it, it reduces, the fluid comes out, but later on again the accumulation of fluids takes place. So that is a kind of mucocele that we see in day-to-day life. And the other one is ranula. The ranula, which is also called a frog's belly, it's a larger kind of a cyst which is seen in the floor of the mouth. It occurs due to the accumulation of the fluid or sometimes trauma to the sublingual salivary gland. So it causes elevation of the tongue and it can be palpated. If we palpate it from the mouth as well as from the outside, bimanual palpation will also help us to know that whether it is ranula or not. And it looks like a frog's belly because it is mostly bluish in color. So it is called ranula. So if we come for the treatment aspect of this two cyst as such, so for the ranula, it is mostly surgical excision. Okay, we can go for surgical excision of the cyst, local anesthesia, or if it is size is bigger, we can also go for a general anesthesia for this case. Or we can go for marsupilation. Marsupilation also called a PARS procedure, in which what we do is that we open the cystic lining. Cystic lining is coated with the oral epithelium and maintain the of the cystic content so that it keeps on draining. And as the time progresses, the cyst shrinks in size, becomes continuous oral epithelium. So these two cysts are from the retention cyst in the oral cavity. And if we go for the facial cyst, that is of the dermoid cyst and the sebaceous cyst, those are also surgically excised. And other cysts of the jaws that we can go for the developmental origin are like the if it is of odontogenic origin. So the most common cyst of the odontogenic origin is the residual cyst, is the radicular cyst. Radicular cyst mostly is seen when somebody has a cavity, carious tooth. So they come after a long time and they say that there is a pain, swelling of the jaw, and there is recurrent pus deposition, which we have seen in the X-ray or clinically. Also, there is sinus tract formation from the jaws as well. So those are the radicular cysts in which the tooth is becomes non-vital due to infection. Pulpal infection occurs and the tooth becomes non-vital. So in those, we have seen that cystic expansion of the jaw. So in those cases, the treatment we do is systemic enucleation. Along with, we can also go for the extraction of the tooth if the tooth is mostly damaged and we cannot save it. We cannot go for an RCT, so we have to remove the tooth along with cystic enucleation. And for the cavity that is formed, we can either go for a bone graft or leave it as such, because there is a good potentially the basal bone is intact. So the basal bone recovers and the bone formation takes a period of 6 months to 1 year. Other, if we see, so there the second most is the dentigerous cyst. Dentigerous cyst of the jaw is mostly seen in the like 20 to 30 decades of life, or maybe seen earlier. It is mostly seen due to there is a infected tooth which has not come out of the oral cavity for any reason. Either it is the jaw size is small, or the tooth size is bigger, and it is a hindrance from other tooth, or the deciduous tooth or the middle tooth which has not fallen, has not given a way to come for the permanent. It is mostly seen in the third molar region that we see in the wisdom tooth. The wisdom prone for this dentigerous kind of cyst. So it is mostly advised for all the young people to get the wisdom tooth extracted, because at the age growth there are many chances of this cyst and tumors that can occur in your jaws also. So I would mostly recommend them to get it extracted, so in later life you don't face such kind of problems. So in dental cyst also, there is mostly caused due to reduced enamel epithelium when the during the time of embryogenesis or the time is tooth is forming. So this time this tooth gets faded, and then the cyst transformation takes. There is a particular form in which the cyst forms, like the cyst form when there is a cyst initiation stage is there. Cyst initiates, and there's the cyst generation generates, and the cyst expansion takes place. Cyst initiation can be due to any inflammation or trauma or decrease in their immunity status, and then what happens? The cyst enlarges. In the cyst enlargement is what happens. The cyst will the innermost portion of the cyst becomes devoid of oxygen, and the carbon dioxide concentration increases. So there is a cystic degeneration. There will be a cystic degeneration causing liquefaction process of the cell, and the inside part, the innermost part of the cell will die, and there will be a empty space created because of that. So if the space is created, later on what it will do, it will secrete prostaglandins and osteoclastic resorbing factors. So this factor will cause the degeneration of the bone thereby. And as the osmotic pressure, there will be epithelium, as we have already discussed in the cyst, there will be epithelium in the cyst, which will cause the osmotic disbalance in the cyst, and it will accumulate fluids from outside. So in that, the cyst will keep on growing by resorbing the bone and expanding due to accumulation of the fluid. So this is the pathogenesis of the cyst. So other cysts which have mostly we have come across are the dentigerous cyst, then calcifying odontogenic epithelial cyst, in which the calcium deposition also seen in this cyst. Other is adenomatoid odontogenic AOT, adenomatoid odontogenic cyst. Sometimes it is also called tumor. And other cysts that we can come across are like tumors. Now we will be going to the tumor part of the face. Tumors, the most common tumor in the jaws are the ameloblastoma. The ameloblastic tumors are from the enamel organ, and sometimes mostly this is due to genetic transformation in those cells which causes this tumor to occur. So in the ameloblastoma, it is a unicystic benign tumor, is clinically persistent, anatomically benign, which does not spread to other organs. But the problem is that it is locally very destructive, and sometimes it is also seen that due to sometimes when it metastasizes in the lungs, the expectancy rate for the person is sometimes around 2 years only. So it is very destructive tumor of the oral cavity. So for these tumors, the mostly treatment plan is resection of the jaws. Most of the cysts we tries not to resect and not to go for an aggressive treatment, but this kind of tumors requires an aggressive treatment. With we have to take a positive margin for around 5 margin. We should take section of the jaws is required for this kind of tumors. Other developmental cysts of the jaws are like other developmental cyst will globulomaxillary cyst, then Epstein cyst of the newborn, then palatine cyst are there. So these are developmental cysts which occurs in due course of time. Other cysts like thyroglossal duct cyst, which causes during the developmental stage when the thyroglossal duct and the fovea parietum of the tongue they does not meet. There is a depression left there, and the cystic transformation takes place in that those cases. So these are the few cysts and tumors of the jaws and face. Other tumors can be benign tumors and malignant tumors. Benign tumors can be categorized like if in which cases it is occurring. If it is in the epithelial origin, it can be of carcinomas, or if it is in the connective tissue, it can be sarcomas or chondromas or osteoblastomas, osteomas. So it depends on the site of origin where it is happening, which is taking place. So these are the tumors of in the maxillofacial region. Other tumors that we can come across are the tumors of the salivary gland. Tumors of the salivary gland mostly occurs in the major salivary glands. So that is mostly adenomas. That is pleomorphic adenoma of the parotid gland is the most common tumor that we come across. So in that cases, what happens? There is a slow growing benign tumor, but causes cosmetic deformity. A lot of cosmetic deformity seen in those kind of tumors. So there is a gross expansion of the third of the face, which causes lifting of the earlobe. And there is also, if it is into the deeper lobe, it can also penetrate in the nervous tissues, facial nerve, and there can be facial nerve palsies in those cases. So glioblastoma is the most common tumor. Other than that, we can see Warthin's tumors. One of the parotid gland tumor is Warthin's tumors. In that, those mostly occurs in the male patient in the who are smokers. So these are the most common tumors. Other malignant tumors for the salivary gland can be adenoma, X carcinoma. So those are and these are the malignant tumors, the salivary gland tumor. So this is our structure that I can tell you, so that I can take the questions and keep answering.
Okay. So let's begin with the questions. What tumors are in the maxillofacial region?
What?
What tumors are in the maxillofacial region?
Yeah, I've already told about those. So we can divide it like the facial tumors. I've already told those dermoid cysts, sebaceous cysts, though, and lipomas. So these are the most common facial cysts that you will see. Cysts and tumors, neurofibromas. So these are the tumors that you see in the facial region, and in the jaws region. Already that due to dental origin or some developmental origin, it will be like dentigal cyst, radicular cyst, residual cyst, or adenomatogenic cyst, like amyloblastoma. So these are the both facial and jaw tumors, you know.
Next question. What is the most common cyst in the mouth?
The most common cyst, if you as a face, if you see it is a dermoid cyst that we come across, and in the jaws you will see it is a radicular cyst. That is the most common cyst because the carious tooth are the most, or the traumatized tooth are the most thing that you see in day-to-day life. Yeah.
Okay. Doctor, can you please describe what are the benign tumors of the maxillofacial region?
Uh, Please tell me again.
What are the benign tumors of the maxillofacial region?
Yes, see, benign tumors. These are all benign tumors which does not metastasize. Those are not malignant. Will not grow like. Will be constant in. It will not like metastasize in the other region. It is not that harmful, not that dangerous, but still we need. It will cause a facial deformity and needs to be removed because we don't know whether it can turn into malignant or not. So it is like cyst, lipomas, odontomas, then amyloblastoma. These are all benign tumors, but it can change into tumors if the patient immunity is decreased or some pathology it can change, or sometimes it can metastasize to other organs also. So it is better that if we remove the benign tumors, so it is always important to remove all those tumors.
Okay. So, what are the five most common benign tumors of salivary gland?
In salivary gland, that already told that the pleomorphic adenoma is the most common parotid gland tumors that we see. Other are Warthin's tumor. Then we can also see carcinoma and pleomorphic adenoma. Those cases. Then mucosal granulas. These are benign cysts that is seen. Then what we have already discussed it. These four are the most common.
Next question. Do benign tumors need to be removed?
Yeah, tell me again.
Do benign tumors need to be removed?
Yeah, definitely those tumors should be removed because see, sometimes what happens like tumors like neurofibromatosis and all those because it is the chances of recurrence are very much. So sometimes they are told that not to be removed, but most of the benign tumors are to be removed so that it does not it causes the gross facial deformities also for the patients or so for as the aesthetic concern. So we mostly remove all those tumors.
Can a benign cyst become cancerous?
Yeah, it can become cancerous because sometimes we have seen there is a malignant transformation of these cysts, tumors into cancerous cells, and sometimes this you will not see in the as such in the primary places, but it can metastasize to other places also. So benign tumors can become cancerous sometimes.
Okay. So, can benign tumors be cured without surgery?
No, benign. There is no kind of a medical management for this. Mostly we go for surgical treatments only. So surgical therapy is the only choice of treatment for the benign tumors. But if it is for lymphomas, the lymphatic gland tumors, so sometimes we go for chemotherapy also. And many of the tumors that are few radio resistant. So if we go for radiation also, they won't be helping us for those tumors. So most of the cases, it is a surgical line of treatment that we have to do.
Okay. How do you know if a tumor is cancerous?
The tumor is
Cancerous.
okay. The important thing is that we have to go for a biopsy for any kind of lesion. If we see that, first of all, the clinical feature will only tell us a brief diagnosis we can get from the clinical feature. But exact diagnosis, if we think that it is a malignant or a cancerous lesion, then we have to go for a biopsy. Either FNAC will help or a specimen biopsy like incisional biopsy or excisional biopsy will give a better idea for that, an exact idea for that lesion, whether it is cancerous or not.
Is maxillary cyst cancerous?
Maxillary cyst can be,
Cancerous?
yeah, it can be cancerous. See, it depends on the cyst, what is happening, or the tumor, what is happening. So it can get you transformed to malignant changes can occur in those cysts. It is the you cannot say that which cell will divide how. So it is not into our hands. So sometimes they can be cancerous also. And the main important thing is that the structure that structure loss that it occurs due to cyst or tumor. It is so it is better that we remove that surgically excise that cyst so it can become cancerous. So why to wait for that? So before that only excise the benign part and better always.
Okay. So, doctor, what is the most common oral tumor?
Most common oral tumor.
Tumor.
The oral tumor, if you see that it is benign tumor, like amyloblastoma is seen quite often. So that is mostly most of the common tumor is amyloblastoma of the jaws. Yeah,
What is the most common tumor found in oral cavity?
most common
Tumor found in oral cavity.
oral cavity, which are like see, ranulas are very common, mucosals are very common. So these are the benign tumors. That is, papillomas are seen, fibromas are seen. So these are very common oral tumors which we see. These are benign tumors.
Okay. So how do they remove maxillary cyst?
How to
How do they remove maxillary cyst?
how to remove maxillary cyst.
Okay, so moving on to the next question. Can facial cysts be cancerous?
Please tell me again. I'm not.
Can facial cysts be cancerous?
Yeah, all kind of cysts can be cancerous. There is a malignant transformation if of all the cysts can take place. So those cysts can be cancerous. So even if we see a benign lesion, also the biopsy is must for all lesions. So that at a later stage we should not think that if it can go for a carcinomatous change or not. So these are important for all cysts.
Okay. What are the symptoms of maxillary cyst?
In maxillary cyst, if we see, though mostly we'll see that if first thing that we should see is the any tooth is having caries or not. So that will give an idea of whether what kind of cyst it is. Sometimes we see that whether any tooth is impacted, the tooth has not come out, so that will give an idea of it whether it is a dentical cyst or not. Sometimes what happens that nasolabial cysts are also there in the maxilla, so those are developmental cysts. Globulomaxillary cysts are there; those are developmental cysts. So there will be a gross facial swelling. There can be initial stages, we cannot see any kind of swelling for the patient, but later on it is a slow growing, mostly the cyst slow growing. So there will be a gross facial edema that will cause in the maxillary middle third of the region of the face. And radiographically, if you go, there will be a distinct cystic cavity, which will be lined by an epithelium. There will be radiolucency will be there. So when we aspirate from those content of the cyst, so we will get the cystic fluid. Those also give an idea, and we can check for aspiration cytology. So we can get an idea of which kind of cyst is that. There can be also playing of weight and pain. Also, patient complaints of pain in those teeth also. So floating appearance also seen because the bones are lost and there is no surrounding structure bony structure for the tooth to exist in those cases. So there will be tooth loosening of tooth can be there, and in X-ray we'll see a floating tooth appearance because there is no bone to hold the tooth.
Okay. So how do doctors know if a cyst is a cancerous?
Biopsy is the only process that only test can tell us that whether it is a cancerous or not. Sometimes that clinical feature can tell us, but the biopsy is the ultimate test that can help us to know that whether it is a cancerous or not.
Okay. Can facial cyst be removed?
Yeah, facial cyst can be removed. We have surgically those can be removed. Enucleation of the cyst occurs, and cosmetic corrections can be done in those cysts also. Sometimes cysts like hygromas and few kind of angiomas, blood vessel cyst requires sclerotherapy. Like sclerosing agent, we use sodium tetrahydrosulfate and steroids treatments are there, which will squeeze the tumors like angiomas or any vascular tumors are there. So those can be done.
Okay. So doctor, what is the difference between a tumor and a cyst?
The tumor is a solid mass. It is a cell. When the cell is uncontrolled, it will grow uncontrollably, and the solid mass of cell mostly. And the cyst is a sac-like pouch. It will be an empty space. So cyst is an empty space which in which you can find fluids, serosanguinous fluid, or gaseous elements also. But the tumor is a solid mass of uncontrolled cells that is growing.
What are the signs of facial tumor?
Signs of
Facial tumor.
see, facial tumors will mostly give you like facial deformity. It will be like a nodular swelling. Okay, there if it depends on what kind of facial tumor it is. If it is a blood vessel derived tumor, it will be of reddish color, or if it will be bluish color. If it is a melanoma, which is like a brownish color or blackish color, it will give. So it depends on the origin of the tumor, and it will be a nodular or can be pedunculated tumor. So there will be gross facial deformity in those cases. In the oral side also, if you see there is a elevation of the palate, or there will be uh, cauliflower-like growth. So these are the clinical features through which we can see that whether it is what kind of tumor it is.
So can facial tumors also be removed?
Yeah, facial tumors, we have already discussed now that facial tumors are removed for cosmetic corrections, and sometimes that it also like the pleomorphic adenoma. So those tumors cause facial deformity. Later on, it can compress the facial nerves and cause functional deformities also. So those tumors have to be removed.
Doctor, what are the treatments of a jaw cyst?
Yeah,
What are the treatments of a jaw cyst?
treatment of the jaw cyst. See, in the treatment for the jaw cyst, what we do is if the tumor size is the bigger size, so what we do is first we do a marsupialization or a dredging. In those marsupialization, what we do is just remove the cystic content from the cavity and suture it with the oral epithelium, and we keep on irrigating it with regularly with either iodine paste and keep on changing the or coating. So what happens? The size of the cyst reduces. This we do in the cases where the cyst is very large and which can cause like which compresses the nerve warning connect structure size around the cyst. So when it comes to that, it will reduce the size of the cyst. So in those cases, we go for this kind of treatment. If the cyst is small, so that we can go for elimination of the cyst. Sometimes what happens that if the cyst is like occupying a major mass of the bone, so in those cases, surgical section along with a good margin, we take a good margin so that so that there is no infiltration of the cystic content into the good bone, so that later on there is no problem of any extra tissues that may be left after the surgery will remain in every bone. Yeah.
What are the ways of treatment for jaw cyst and how can it be recovered?
See, the mostly if the size of the cyst is less, we can leave it as such and allow the bone to heal by itself. So it will mostly take around 6 months to 1 year to recover. But if sometimes what happens, there is lot of bone is removed from that. So in those cases, bone grafts are required to put in those affected areas. Sometimes what happens is the segmental resection in cases of ameloblastoma are done. So we do a titanium prototype is placed. So we do a 3D printing of the patient's jaws. Both the whatever area it is there, maxilla or mandible, both the jaws 3D printing is done. In 3D printing, what we do is the defected side is also taken and the uh, healthy side is also taken. And we do a surgical cut of previously. For the surgery, we give the surgical cuts to the 3D printing people and they design the cuts accordingly. And the prototype the titanium implants of the jaw. That is, sometimes what happens, the cyst involve total, like the total condyles are involved. In those cases, what we have to do is the make a prosthetic jaw joint condylar joint constructed with the titanium implant. So we do a prototype of that, and later on, after surgical cutting, that will be the exact replica of the healthy side of the face. Exact replica. So the joint will be the exact replica of the healthy side, and we just incorporate that to the other side. That will be a mirror so that the continuity of the bone is maintained. Patient may not be having the bone, but the titanium implant will be as good as the lost for the patient. So that is the best treatment option, and rehabilitation can be done. Because in that titanium implant, we can also plan for the implant for the patient. If the patient has lost the tooth along with the jaw, the implant can be placed with the titanium rods. So that is really very good for the patient rehabilitation so that later on the aesthetic of the patient is also maintained along with the function of the brain is also maintained.
Okay, so moving on to our next question or a last question. How many days will it take to recover?
How many days?
Will it take to recover?
Recover. It will take to recover from this.
How many days will it take to recover?
It depends, like I've already told you that it depends on the size of the cyst, that how much it will, if it is a small cyst, it will take around a month or something. Like it will, if the patient goes for a day-to-day life, it is 2 to 3 days it will take. But if you want the bone to form, it will take around 6 months to a year. Or if it is large cyst, bone does not form slowly. The patient can go throughout within 7 days itself.
Okay. So, is there any live question you can ask?
Yeah, we can take the questions.
Doctor, can these tumors be treated with medicines?
See, all I've already told, few tumors can be treated with medicines like this angiomas, blood vessel tumors. If it is small, we can go with sterilizing agent injections. But not all tumors will help you in this injections. It is like most of them has to be gone for surgical incisions. Very few will work with the medications. And the main important thing with the cyst is that there is a epithelial lining. Until and unless we remove the lining completely, it will keep on eating the healthy bone. So it is very important to remove the cystic lining.
Okay, so Mamta Rawat is asking what are the most common symptoms of cysts and tumors of the maxillofacial region?
See, the most common, as I already told you, if it is in the face, you will be seeing it like a elevation or a bump you can see in the face. Okay, if it is in the jaw, there will be like pain in the tooth, or there will be no discharge also sometimes. And regarding the if it is in the face, there will be gross facial deformity that will come to your notice. If it is in the jaw, there will be pain in the tooth, or there will be swelling inside of the cyst.
Okay. So next question is, are there any non-surgical treatment options for maxillofacial cysts and tumors?
Non-surgical, see, same questions are coming, but the non-surgical treatments are very less because everything is some abnormal tissue that has accumulated in the body. So those has to be removed. If we don't remove, if again I will tell you the blood vessels tumor also, if it is very big in size, we have to remove that. We cannot go only for just the most of the treatment is surgical for the
Okay, so Vikku Rawat is asking what are the some of the treatment options available for maxillofacial cysts and tumors?
treatment options, see, sometimes that we go for, if it is a central giant cell granuloma, sometimes uh, calcium injections are also given in those cases, sometimes interferon injections are given. So there are medical managements are there, but how much successful it will be, we cannot say that. So because if you remove the cyst or the tumor as such, we can we take a positive margin and we are sure that yeah later on the chances will be very less of those cysts.
Okay, so any more questions? I guess no. Okay, thanks for joining us, doctor.
Okay, thank you so much.